I'm Chad Sparks in the community, and today we are in an organization that serves its community in so many ways. I'm with Tom Culberson, who is the director at Quad County Home Health and Hospice. And Tom, welcome to In the Community.
Thank you.
Well, first and foremost, when we came here, we understand it looks pretty new. I mean, this looks like a pretty new building. How old?
So we moved into this building in 2016.
I figured it was pretty new.
We've actually been servicing the community since 1984.
Okay.
Starting out with our home health. And again, in 2016, the hospital opted to invest in its home care and built us a brand new building. So pretty proud of it.
Have you always been affiliated with Pana Community Hospital?
Yes.
Okay.
We've always been a part of Pana Community Hospital, but our service area has grown and extended beyond Pana Hospital's service area. So now we cover 5 different counties: Christian, Fayette, Shelby, Montgomery, and Macoupin County in Illinois.
So when you say Quad County, this would almost be like Quintuplet County. Because,
yeah.
Okay. And I guess maybe you could keep expanding because you do so well in the counties that you serve. Okay.
Yep.
You mentioned durable medical equipment. You have to tell us about this. I'm a novice. I want to learn.
Yeah, so one of the things that we service, and we started doing our durable medical equipment sometime in the mid-'80s as well, is it's anything from hospital beds to oxygen to CPAP, anything medical equipment that the patients would need. So we take our referrals from our physicians. Families can come in and purchase items as well, and most of it's covered by insurance. So that's a good thing, but that's essentially what it is.
Okay, and is that a large part of this organization, and is it a newer part of this organization?
It's been around since the mid-'80s, so
Okay.
it's about a third of our business.
Okay,
And so
nice.
we, again, service all the same counties. They do free home delivery and setup for the patients in our community as well. So
I feel like that would be important for a guy who really wouldn't know how to set any of this up. I think they would greatly appreciate that.
Oh yeah, especially. And when you think about it, the demographics too, typically they are sometimes our elderly population
Sure.
is requiring some of these things. So it's that special touch that they can come in and get everything set up and make sure it's working for them in good working order.
Let's talk about home health, because that's part of your name. And again, I'm assuming that's probably something that's growing in your industry.
Oh, absolutely. Especially with the COVID-19 pandemic, that really brought a lot of light to what home care can really do by caring for patients in their home. So it's a skilled arm of our service. Our patients typically require things like short-term therapy. Maybe it's a wound, maybe it's some short-term IVs. So typically they're with us for about 30 days, sometimes a little bit longer than that, where we have a whole team that comes in, whatever their needs are, whether it's a bath aide, a nurse, social worker, therapy, all coming in to help meet their needs and help them stay in their home.
And something about, you mentioned this, chronic care management. Okay, so that's part of this, but explain how that is part of this.
So chronic care is slightly different because with skilled home care, typically the insurance will pay for so much, and there's a point where they're no longer homebound, but they still have a lot of needs. And so chronic care is something that Medicare has developed to help meet those needs. So the patients have to have 2 or more chronic conditions. And a lot of it's phone checks in just to double check and see how the patients are doing. Some of it occasionally can be an in-person visit as well, but it's more or less helping patients learn how to manage their disease, again, from the comfort of their own home, and try to keep them as healthy as possible.
There's also something else. I'm using this verbiage, remote patient monitoring. Likely something that goes along with what you've just talked about.
Yeah, it's definitely a companion service to both of our home health and our chronic care management. So we have equipment that's Bluetooth enabled. So it's scales, blood pressure cuffs, pulse oxes. We can even send assessments for them to screen them each day to see how they're doing. We set those patients up in their home, and then we ask them that by 11 o'clock they check all their vitals, and then it gets transmitted into our office. And we have a nurse here that monitors them throughout the day and can actually help catch alerts if there's an issue. I know there's been some times where we've caught some things and been able to notify the physicians right away so they could get treatment with a low heart rate or something like that. So, yeah.
Literally, this allows the person to stay at home, feel independent, and still be cared for. It's
Absolutely.
an amazing service. Now, talk to me about, we've talked about home health and certainly the components of that. Hospice, it's in your name. It's a big thing. I mean, this is becoming more and more prevalent, I think.
Absolutely.
Okay.
Absolutely.
How do you guys function with that?
Yeah, so hospice is for patients who have an illness that's not curable, typically, and typically the physician has to say that they've probably got 6 months or less to live, but nobody has a crystal ball, so we care for them as long as they live with us. We also have volunteers as well that come in and can provide respite for the family and some connection as well. And we take care of them wherever they call home. So
my next question is, your history here. You obviously know Pana well. Tell me about your history in this community.
Yeah, so I actually grew up in Roseman, so I'm a
Which
local
I know
boy.
that's close.
I'm looking 4 miles from Pana, so yep. But I was one of those kids that decided I was going to go away, and I moved away to Ohio for a while, and then East Tennessee, and finally came back to the area after I was married and started having a family. And but then it was in 2015 that the position opened up here at Quad County. And it just, after about a month and meeting with the leadership at the hospital, I was kind of sold on the fact that I could actually take care of those, impact the community, the people in the community, our neighbors, people that I knew,
Well, if anybody needs to know about the community, you would know about it being from Rosemont, and I love the fact that I know where that's at.
Yeah.
So we know that's close, so that's great.
Yep.
Okay, so with regards to that, one of the great things that we get to do with our In the Community segment, and we're all about, in our organization, we're all about family, we're all about community. We espouse those attributes every day. We get to come in and meet fine gentlemen like yourself who comes into the community every day and serves them. Tom, we're grateful that you do this. Again, I don't know how often you hear thanks, but we're going to say thanks because it means a lot to us, and I know it means a lot to the community for what you do. So thanks for coming back. You couldn't have stayed in Ohio. This community needs you.
Yeah,
we're grateful.
It's been an honor.
Great. Well, with that said, we're going to talk to one of your associates that we know is skilled in other areas too. We're going to learn from her. But before we close, I have to ask, because every great leader needs a great team, and we're going to find this out very soon. How many people do you have, volunteers and employees, that work through your organization?
So with our volunteers and employees, including everybody that provides even some part-time services, it's about 35 individuals. And the unique thing about it is everybody lives here. Everybody lives in our community, even our ownership. Our CEO and our CFO from the hospital, they all live in the community, which is kind of unique.
Well, Tom, it has been a pleasure getting to know you and your organization. We can say thank you. We will continue to say thank you. Thank you for being such a strong force in this community, and I know they appreciate it. We do too.
Thank you for coming today.
Oh, my pleasure. Well, we can do this more often. Thanks again, Tom.
All right.
So folks, we jump directly from Tom Culberson, who's a director at Quad County Home Health and Hospice, to our next guest. This is very special. This is Sam Burton. She is, and I'm going to get your title correct, you're a medical social worker right here at Quad County Home Health and Hospice. Okay. Sam, tell me about what you do here.
I work a lot with the home health workers. The physical therapists and nurses will reach out to me if they're with a patient who might need some connection to community resources. I have a lot of connections in other counties. I might put people in touch with resources like caregivers or Meals on Wheels. It might be something simple like that. And then I've done some brief counseling with patients. Of course, since with home health, we're not in there long term, so I may need to refer them to outside counseling, but at least we can get them started while they're with us.
Your day-to-day strategies, when you come into work, and you obviously will meet with Tom, and Tom may lay out some of the things that are going on, what's that one thing that really drives you? That thing that where Tom would say, you need to do this today, that you get very passionate about?
So I think it's really what drew me to social work, and part of what I get to do here is that I like it when people figure out their full potential. When they figure out what they're capable of, or that they actually do have access to a resource that maybe they had no idea about.
This touches on something that Tom said, because Tom had mentioned a lot of people kind of like to have their independence. They like to feel like they can kind of maneuver and manage the situation that they're dealing with. And I feel like in social work, that's what great social workers do. They kind of help them to see that they matter, they can function, they can do these things. And I would think that you would be the perfect person to help them see that.
Thank you.
You work with volunteers. How do you do that? What does that look like?
So for our volunteers, we have around a dozen volunteers right now. that see patients, and they see them in various ways. Sometimes they will go in just to give a patient somebody to talk to, just a friendly face to visit with. Sometimes we've had people go in and help do some light housework in a patient's house if they're not able to do it any longer. Sometimes they will provide respite care. So if a spouse has been taking care of their loved one while they're on hospice and they either need to run errands or maybe they just need to get out and clear their mind for a little bit, volunteers can come in and sit with that patient so they're not alone and there's someone there if they need something.
One more thing that I have to discuss, and that is, you mentioned grief support. And in our line of work, that's something we consider every day. We talk about it a lot. We obviously work with that a lot. Tell me about your connection with grief support.
So grief support we do in a few different ways. We have mailings that go out quarterly to families in the first year after a loved one passes. So we stay in touch with them. I make regular phone calls to families until they tell me that they're in a place where they no longer need me to follow up with them.
It's an amazing service.
We don't want families to feel like we have just disappeared after their loved ones passed away. We still care about them. We still want them to know we're here to support them. And then we also have a grief support group the first and third Thursday of every month here.
I was going to ask.
Yep.
I think people would see this and say, I need to talk to somebody. And so it's right here?
It's right here in the office,
Okay.
8 Huber Street in Pana at 6:30. First and third Thursday of every month.
Okay.
And it's a really open group. I usually try to start out with either a reading or a prompt or something to just get conversation going. And then from there, we try not to have a whole lot of structure because we don't know what everyone who's coming, what might be on their mind, what they might need to talk about. And it's just nice because you can usually find someone to relate to what you're going through. And I think that's what people need the most.
I love that. And we agree. And again, you know, as part of McCracken-Dean Funeral Home, our goal is to provide those services, and our goal is to always function in that way with every family that we meet. Mm-hmm. It is great to know that before we meet those families with their needs, you're working with them on their needs. Mm-hmm. And that's the partnership. That's part of being this great community and how we support each other. And we treasure that. We cherish that. So this is a wonderful opportunity for us to know that it's being done on that end with you guys as well.
Yeah.
Knowing what you know about the community, one of the greatest, in your opinion, one of the greatest services that you provide for these communities and counties, what would it be?
I think just, especially for the hospice patients, companionship.
Which is huge. It's huge. And again, I think all of us recognize that we need that fellowship. We need that time together. And as Tom had mentioned, especially after the COVID pandemic, I mean, a lot of people were left isolated and alone. And I think that individuals like yourself that come in with a smiling face and they have a huge heart, I think that people would appreciate that tremendously.
Mm-hmm. Yeah, and some people just need somebody to talk to. And it's not always easy to talk to your family when you're going through such a life-altering event. So I try to be a safe place for them to open up and share what they're experiencing.
After speaking with you and spending time with Tom, there's no doubt that this would be the place to come if anybody would need that type of service and that type of help. And that encourages us. That warms our heart. We love being in the community where we find organizations that serve their community well. Sam, you do.
Thank you.
Your organization does.
Yes.
Does a really great job. Well, folks, this is, for us, always an opportunity to come and really learn about these various organizations. Sam, you've done well. Tom did an amazing job. We're so grateful. And we're so grateful that we have these relationships. We treasure them, and we always will. And for everyone who's tuned in today, thank you so much for joining us in this community segment. We're grateful for this. But we also want to encourage you, if you have any questions, 217-562-6380. 217-562-6380. And folks, if you want to visit the website, and Sam, some people do. Some people say, I'm not comfortable picking up a phone, but I'll get on a computer. PanaHospital.com. That's the best place to go, PanaHospital.com, on behalf of McCracken-Dean Funeral Home. And again, all about partnering with family and community. We always say this, locally owned, family operated, values oriented. And that makes us happy to say it, but it makes us even happier when we realize that we have this great relationship with this great organization right here in the community.
Yeah.
Sam, you represent well.
Thank you.
Yeah, and Tom did too. And so it is our great pleasure to be here today. And for everyone who tuned in, Thanks so much for joining us. We hope you learned as much as we did. And if you are ever in need of these great services that this organization provides, please reach out. You won't be sorry. They are here for you. And on behalf of McCracken-Dean Funeral Home, thank you so much for spending this time with us. And we look forward to seeing you again in the community.